Hey, everybody. Welcome to the Health Babes podcast. I'm your host, Dr. Becky Campbell with Dr. Krystal Hohn. Today, we have my friend, Deidre Ferenc on. She is a breast cancer survivor, and she is here to tell us all about her story from before she got diagnosed to getting diagnosed to what she's done since and her journey with chemo, her healthy lifestyle, and how that played a role in her recovery. So let's welcome Deidre. Hey guys, let's welcome Deidre. Deidre is my friend from fourth grade. So we have a long history together. We were best friends for years, and we kind of lost touch over, going to different schools. But of course, through Facebook, we found each other again with like so many people. So Deidre and I have been talking a lot lately because she was recently diagnosed with breast cancer. So this is Breast Cancer Awareness Month, and we wanted to, have Deidre come on and tell her story because it's a great story, and I think that, the listeners, you guys are going to get a lot from this. So let's welcome Deidre.
Hello.
Thank you so much for coming on. We appreciate it.
Thank you for having me.
Mm-hmm.
All right. So let's kind of, start from the beginning. Like, how did this whole thing come about? How did you even find out that you had breast cancer?
So I have a history of cancer in my family. My grandmother on my mother's side actually had breast cancer twice. She had it at age 50 and got it again at age 80. Because when she was 50, she only had a single mastectomy because that's what they did then. And then she ended up having to have the other side operated on 30 years later.
Wow.
And then she did survive both times. She made it through. She lived to be in her 90s. And then my other grandmother actually passed away in her early 70s of ovarian cancer. So my OBGYN was very aware of my family history. And back in 2016, when I was just seeing him for a regular checkup, he suggested we do some genetic testing because of the family history. And so that was kind of what started it all off. So I did that, very simple, one little vial of blood. And it came back that I did have a gene mutation that put me at a much higher risk for breast cancer.
Okay.
It also increased my risk of ovarian and pancreatic cancer, but the main component was the breast cancer.
Okay.
So that's kind of how this all started about, I guess, 6 years ago now.
Wow. So what you mentioned genetic testing. So what genetic testing did you do?
So it was called a MyRisk panel, and it tested for an array of different gene mutations. So a lot of people think breast cancer, and even since I've been diagnosed, and I say, oh, I have a gene, they're like, oh, you have BRCA? No, I did not have BRCA. I actually have something called PALB2.
Okay.
And there are tons of different breast cancer genes out there that they have discovered. So it used to be only BRCA, BRCA1 and BRCA2, but now they've discovered all these other gene mutations that are making people much more susceptible to not only breast cancer, but all different cancers. And you can actually test for it, and you can know you're at a higher risk so that you can start to be more proactive about it. So with my PALB2 gene mutation, I basically had a 40% chance of developing breast cancer at some point in my lifetime, which is much higher than the regular population that did not have PALB2 or a gene mutation.
Yeah, it's crazy because you only really hear about the BRCA gene, and even when you and I were talking about it, I even assumed right away BRCA gene, and it's really good to get that information out there that there are these other genes and what to look for and that genetic test because people, and, one of my other really good friends, she has a lot of breast cancer in her family. And when she got tested, she's like, nope, I don't have the BRCA gene. So it's like, now we know you didn't either, right? Yeah.
And it's constantly developing and changing. When I first found out in 2016 that I had this PALB2, there was no ovarian component. It was only breast and pancreatic. But as they've studied and learned more, they recently added the ovarian component.
Yeah.
So it's kind of like something that's still just developing constantly. And, why not be proactive about our health? It was one vial of blood. It literally took, all of 30 seconds for them to draw. They sent it away. And then a few weeks later, you found out, whether you had any of the mutations or not.
Wow.
It's true. Those gene tests are always evolving. I mean, even if you
Yeah.
do like 23andMe, they constantly are
Yep.
updating like things. Yeah.
And
So,
when I
okay.
was first diagnosed, or not diagnosed, but found out the PALB2, they told me my lifetime risk of breast cancer was 30%. Well, just in the last year, they've increased that to 40%
Okay.
because of following the people with PALB2. When I first found out, there was no talk of a prophylactic mastectomy. They didn't even mention that to people with PALB2. And my breast surgeon informed me that just in the last year, they are now talking to people that are just now finding out they have PALB2 about getting prophylactic mastectomies.
Okay. And okay, so, and we're going to get into that because I know you did that in a minute, but so after you found out you had that gene mutation, who did you see? Like, what did you do at that point?
So my OB referred me to a breast oncologist because he really was not sure what he was supposed to do with me. He didn't know what I was supposed to do now to be proactive. So I started seeing a breast oncologist, and she said I had to be screened every 6 months. And it had to be a combination of, and I was 37 at the time, by the way. So I was not getting mammograms. I was not doing anything for screenings yet. So the breast oncologist said, you're going to have to start getting screened every 6 months with a combination of mammograms, ultrasounds, and MRIs. So you had to do one of those basically every 6 months. And then, seeing her every year as well, just as another doctor that was doing a professional breast exam. So I kind of spaced out when I saw her and when I saw my OB. So like twice a year, I was getting that, that professional exam, if you will.
Yeah.
So did they find anything when you got, what did you do first?
She did mammo, and that first time at 37, I had a mammo and ultrasound. They saw nothing. I was pretty good about my screenings initially. Now, with the MRI, the MRI was with contrast, and I did not want to put contrast in my body every single year. A friend of ours that's a radiologist actually said, don't put contrast in your body every year at 37 years old.
Yeah.
Start that now. So my oncologist and I had agreed that I would only do the MRIs every couple years. We would try to space it out. And then I would be a little more, I would do my mammograms and then try to wait 6 months to do the ultrasound. Now, sometimes they would think they saw something on the mammogram, so then I would have to go in right away to get the ultrasound. Nothing ever turned out to be anything in those initial years.
Oh,
but
wow.
that's basically the screenings that I was doing. I was supposed to be doing my self exams as well, but I'll be honest, that maybe happened a couple times a year instead of every month like it should have been.
Yeah.
Right.
Yeah. So what was the timeline of, you got the genetic testing, you went in for your screenings, you weren't doing the self exams. What was the timeline when they, let you know, Deidre, you do have cancer? Kind of walk us through that.
So this past February, I was due for just my yearly checkup with the oncologist. It had been about a year since I had had a screening. I had an MRI a year prior. So I had an MRI a year prior. I kind of missed that 6-month screening because, sometimes life happens and we do that.
Yeah.
So I went in to see her in February for my just yearly checkup with her. And almost instantly when she went to do my breast exam, she immediately felt 2 lumps in my left breast. Very close to one another. One was kind of like at 1 o'clock and the other like at 2 o'clock, right off of my nipple. And she put my fingers on them and I could definitely feel them. I mean, they were very palpable. Had I been doing my self-exam,
right? You hadn't felt yourself before?
Never. I'll be honest, the last time I had done a self-exam was probably 6 months prior, on the night that I took dinner to a girlfriend who had just had a mastectomy after having breast cancer.
Oh.
And I went home that night and I did my self-exam in the shower, and then I probably didn't do it. I had not done it again.
Yeah. And
Wow.
what did they feel like, if you could describe them? Because we do get a lot of questions about that. Were they hard, movable, kind of walk us through that.
Painful, not
Yeah.
painful.
Not painful, had no idea they were there, no symptoms. They felt like a pea.
Yeah.
They felt, one of them, one was bigger than the other. One of them was 1.2 centimeters and the other was like 0.9. But the larger one was only 2 millimeters from my skin. So
Oh,
it was like right there, and it felt like a pea. You could move them around, you could push them a little bit, but I mean, it was, I'm not going to say it was hard, but it wasn't soft. Like it
Yeah.
was, you could definitely feel that, sometimes when I had done breast exams, you feel things and you're like, what's that? Is that so? This felt very different.
Yeah.
if
It was like
that makes sense.
noticeable.
Yeah.
Yeah. We learned in school, and to do all the, exams, and it was like hard and movable, painless. I remember that, like
Mhm.
from knowing the difference. But so that makes a lot of sense. I mean, you said yours was a little bit movable, but as far as being hard and painless, that makes a lot of sense.
But not like movable a lot. Like I could move it with my finger, but
Yeah.
it's not like I could push it all around like when I
Right.
felt other
Right.
things in the past. But it was
Yeah.
definitely, a hard round thing.
Yeah. And Deidre, through this time too, like with you, them finding the lumps, what was like your energy like? Like, how did you feel? Because so
Right.
many people think, there's no way I could have this, or I feel on top of the world, or I have so much energy, or you see the opposite too. So what was your experience with that too during this?
I felt great.
Yeah.
Like I live a very healthy lifestyle. I'm in health and wellness is, my career. So I was working out, I was eating well. I was living my life. I was doing the mom thing and running around every day. I was shocked. And when she first felt the lumps, I didn't worry. That's
Yeah.
my personality. They say something like 8 out of 10 lumps are not cancer. And my oncologist was, I think, trying to put me at ease. And she's like,
Yeah.
let's not worry unless we have to worry. So,
Yeah.
when I left the doctors that day, I told my husband, but I didn't say anything to anyone else because I didn't really let it bother me. I just was kind of like, hopefully it's nothing. I feel good. I'm healthy. This will probably
Right.
be nothing, and she
Right.
even said, maybe it's calcifications, maybe it's scar tissue, maybe
Yeah.
it's had breast surgery in the past. So I didn't worry.
Yeah. Yeah.
So what happened after that? Did you get a biopsy?
So she sent me the following week. I went in for a mammogram and an ultrasound. My mammogram was clear.
Wow.
It did not show anything.
That is a key point here. Mammogram was clear.
Yes. And I do have dense breasts. So, anybody that has dense breasts should be getting probably more than just a mammogram. But the mammogram showed nothing. The ultrasound confirmed that there were 2 suspicious masses that needed to be investigated further. So, after we got that information, the following week, I went in and had a biopsy.
Okay. And what did that tell us?
That showed that both masses were invasive ductal carcinoma. So they were, cancer. And it also told us that they were hormone positive. So they were ER positive, PR positive, and they were HERS2 negative. So they were able to learn all of that off of these biopsies from both masses. And they were both the same thing, essentially. They were different sizes, but they were the same exact cancer, if you will.
Do you want to expand a little bit, like what that means as far as the hormones? Like, I mean, you were estrogen dominant.
Right. So my
right?
cancer was fueled basically by estrogen. It was
Right.
the estrogen in my body that was fueling my cancer. They also do something called a K167 score that tells you how aggressive it is. And mine was pretty aggressive. I believe my score was like in the high 60s.
Okay.
So my oncologist basically said, your cancer doesn't care about quality, it cares about quantity.
Mhm.
So it's trying to grow and it's trying to become bigger. But it doesn't really care, you know, how strong or how good it is. It's just trying to grow in you. And so basically she said, we're going to have to move forward with a plan pretty quickly. Like, this isn't something that you're going to be able to sit on for the next few months. We're going to have to figure out our plan and we're going to have to go with it.
So can you walk us through a little bit when you got the diagnosis, the conclusion and the plan that you came up with your team? I know, the mastectomy, and kind of walk us through that.
So, I did see a few different doctors at that point because, I just wanted to get everyone's
Yeah.
opinions. It's the
Got to
type
get
of
your team
person,
together.
yeah,
Mhm.
that I am. But every single doctor that I met with, it
Mhm.
was unanimous that I needed to have a bilateral mastectomy.
Okay.
That even though it was only in my left breast, from everything that we could see, I had this gene mutation, and that I needed to have both of my breasts removed. That was like the number one priority that I needed to do. And in the back of my mind, I can vividly remember when my grandmother got breast cancer the second time, because by that point, I think I was in my late 20s, maybe even in my early 30s. And she said, Deidre, if you ever get this, you take them both. You
Yeah.
don't let them take just one.
Mhm.
Because she had to go through the surgery again at 80 years old. And that
Right.
was just playing in my head. So of course, when it happened, before I had cancer, if there was any thought that if I ever got breast cancer, I thought, oh, I'm having a bilateral mastectomy, I'm taking them both. But then when you're in the situation,
Oh yeah.
it's very different. You start to second guess yourself. And some women don't care about boobs. I was attached to my boobs, I'm going to be
Yeah.
honest. So I was
Yeah.
like, could I just do a lumpectomy? Could I just have a single mastectomy? Those thoughts went through my mind, but I knew deep down, and with what all the professionals and doctors were saying, that was the best course of action. And that's what I needed to do.
Kids, that plays
Yes.
into it a lot, I'm sure, right?
Yeah.
We always make these decisions differently, I think, as moms, or, having anyone to care for, even a spouse or whatever, you're like, maybe I feel this way, but what's the best for
Right.
everybody, just being
Right.
extra careful.
Yeah.
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 So I figured out who my team was going to be, my breast surgeon, my reconstruction surgeon, all of that. And then we got surgery scheduled pretty quickly. I mean, I was diagnosed on March 16th or got that phone call, with my diagnosis on March 16th, and my mastectomy was on April 19th.
Wow.
Okay. Wow. Can you walk us through the experience of that? Like, how was that process? Because so many women are going through that. And I feel like that part isn't talked about as much, right? The process of the surgery, and then getting used to, decisions afterwards and things like that. So I would love to hear that from you.
So I will say this, those weeks, when you're first diagnosed and you're trying to make all these decisions,
Yeah.
that was probably the hardest part. I mean,
Yeah.
you have to make decisions upon decision upon decision, and every decision comes with a pro and a con.
Right.
So it's like, okay, if you do this, then this is going to happen, but this might happen. But if you do this, once I made my decision and I chose my team, it was like a sense of relief came over me.
Right.
Like, I
Action.
definitely felt a lot less stress. Even in those weeks, knowing my surgery was coming, it was like, okay, I have a plan, I have a team, I can move forward. And then, I had my mastectomy, and it wasn't as bad as I thought it would be. I mean, I don't know what I was expecting, but it just wasn't. I did have to spend a night in the hospital. That first night, I couldn't hold my cell phone. I couldn't even hold a styrofoam cup of water. Like, you
Yeah.
literally just have no movement or motion. My husband was a wonderful nurse. He is actually a physician by trade, but he turned into a wonderful nurse, took care of me. And, you know, I would say that, so my surgery was on a Tuesday, and by the following Tuesday, I was out taking little walks outside. You know, I was going and walking, and, you know, I would say the first 72 hours were the hardest, but after that, it was just every day I felt a little bit better and a little bit better.
Mm-hmm, mm-hmm. And they have to, you know, when they do the explant surgery, they have to stretch the skin a little bit, right? Correct. Can you walk us through a little bit of that? And was it painful? Like,
you know, I really didn't have tons of pain. I mean, you feel a lot of pressure. You feel a lot of weird kind of nerve impulses. I don't know if that's the right word, but like, you know, you feel, because they literally just take everything out.
right.
I honestly had a little bit more pain and irritation in my armpit where they removed my lymph nodes, because they made another incision in my armpit to get to the lymph nodes versus kind of going through the incision in my breast.
Okay.
And that kind of bothered me more than anything. So, you know, like I said, my surgery was on a Tuesday. I think I took my last pain pill that Saturday. Like, I never even took another pain. I was just on, you know, Motrin and Tylenol, because I felt pretty okay in that sense.
And then when they took the lymph nodes, what did they find?
So initially they look at your lymph nodes actually in the OR while you're under. They make an initial call on the lymph nodes, and they said that my lymph nodes were negative. So when they looked at them, they only take usually 1 or 2 now. Like back in the past, they would take all your lymph nodes out, but a lot of women were having complications from that. So now they just start with like the first 1 or 2. And then if they find there's cancer cells, then they'll take more. But if those look clear, then they just leave it at that 1 or 2. Okay. They actually, on the morning of your mastectomy, somebody comes in and injects some sort of a dye into the side of your breast, and it makes your sentinel node light up, apparently.
Okay.
So they know exactly what they're taking out. Now, in my instance, my sentinel node was connected to another lymph node. So they had to remove that little cluster. But I am, you know, from what I have heard, and most people, they'll just take out that sentinel node and look at that one.
Okay. And what did they find when they looked at your lymph nodes?
Initially nothing,
Okay.
but then they sent everything away for final pathology. So when you have a mastectomy, you know, they remove your breast tissue, they remove the cancer, and then they have to study it further, because that first look is just initial. So they send it out to get further testing. And when it came back, they found that I had what's called isolated cancer cells in my lymph nodes. Now, medically, they still consider that to be negative lymph nodes.
Oh, okay.
But it meant that there were a few cancer cells that had traveled to my lymph nodes.
Okay. So what did they recommend for you for treatment after that?
So, because of a lot of factors with my final pathology, 1 being the isolated cancer cells, 2 being that they give the tumors a grade 1 through 3, 1 being, I guess, the better number, 3 being the worst, the higher number. Both of my tumors came back as grade 3. And then they do something called an oncotype, which studies the tumors to look at their rate of reoccurrence. It kind of like, you know, dissects the cancer into how likely is it that this cancer is going to come back. And it comes back with a number. You basically get a score. Mm-hmm. And anything 15 or under, and these numbers vary if you're premenopausal versus postmenopausal. So I should mention that. I mean, I was premenopausal. So being premenopausal, if your onco score comes back 15 or lower, you're in the clear. You don't need chemo. Your rate of reoccurrence is really, really low. If your onco score comes back between 16 and 25, that's considered the gray zone. And that's when they have to look at other factors. And then if your onco score comes back higher than 25, you are getting chemo. Like or they recommend that you definitely get chemo. Yeah. You know, debated, I guess. Mine
Yeah.
came back at 21.
Okay.
So I came back in that high gray zone. So they did not like my chance of reoccurrence. My chance of this cancer coming back was higher than they wanted it to be. And then with the factors of the isolated cancer cells, the grade 3 tumors, the genetic mutation, it was recommended to me that I move forward with 4 rounds of chemo.
Wow.
And I went out and got a few different opinions on that again, because, you know, I kind of wanted to do my research. And
Of course.
if I wanted to be the most proactive, I guess that was what the traditional oncologists were recommending that I do.
Okay.
So when you made the decision to get chemo, what was, you know, your journey with the chemo like? I know you had a really bad experience on your first round, but can you walk us through that?
Yeah. One, it was a very hard decision to make, because
Yeah.
For sure.
there are other routes you can take. There are, you know, more natural routes that you can take. And trust me, I thought about doing those, especially being in health and wellness.
Yeah.
Put something in my body that was going to make me feel bad, it goes against everything I stand for.
Of
But
course.
ultimately, you know, I had to make my decision again, you know, those hard decisions, and I decided to move forward. So I had to get 4 treatments every 3 weeks. And at my first treatment, I had a severe allergic reaction 4
Oh.
minutes in to the very first medication. Wouldn't you know
Wow.
that my body would reject the chemo? I wasn't surprised.
Yeah. What was
Right.
that like?
Because
What
you're so
was,
clean, you know?
yeah.
I know. It was one of the scariest experiences of my life. I was sitting there, I had my computer, I was actually getting ready to get on a Zoom training. You know, they started the chemo through my port, and I initially just felt like really weird. I don't know even how to describe it. Like my head just started feeling really, really weird. And I looked up and I saw stars. Like I immediately just saw stars. And then within seconds, I could not breathe.
Oh,
I just,
bless you.
I couldn't breathe at all. And my husband luckily was sitting a few feet away,
Good.
but
Yeah.
he was working. So he had his earbuds in.
Oh, okay.
And I was like, I can't breathe. I can't breathe. And then he wasn't hearing me. So I just screamed, I can't breathe. And he went into action. Even though he's a doctor, I ran to get the chemo nurses, and everything kind of was a whirlwind after that. But that was my first chemo experience.
Okay. Okay. And then the doctors came in and saved the day, right?
Yes. Yes. They
Yeah.
came in, they did everything they were supposed to do. The chemo
Right.
nurses were wonderful, and
Good.
I
Okay.
was okay. But it was basically an allergic reaction to the medication, which about 2% of the population has to that one medication. And it allowed me to switch medications and to something that is actually somewhat considered to be a better medication, but it's 3 times as expensive. So guess what?
Of course.
Unless something like that happens to you, the insurance companies
Don't cover
got to
it.
pay for it. So you kind of
Wow.
have to have that happen. And then they go, okay, now we'll give you this other medication.
Wow.
So
So,
what?
but after that, I finally started chemo again a few weeks later. I had some other things happen that delayed some of my chemo treatments. So, honestly, going through chemo it wasn't fun, but I think I did really, really well with it. I would have my treatments on Tuesdays. Wednesdays, I would actually feel great, probably because of all the steroids and all the other things that they give you. Usually by Thursday afternoon, I would start to go downhill. Like I would all of a sudden just hit a wall of exhaustion,
Yeah.
where like, you know, sometime that afternoon, it was like, I got to go lay down. And then I would pretty much be down like Friday and Saturday, but by Sunday, I would pop right back up. Like I'd spend a few days on the couch, binge watching Netflix or whatever, reading, you know, and then I would come back up. You know, and usually by Monday, Tuesday, I was kind of getting back into my normal routine.
Yeah,
And then
I saw you were even working out through all
Yes.
this. Yeah.
I did. Usually I was back working out by that following week. I would take those few days off. I would allow my body the time. I had a really big appetite through chemo. I did not feel sick. I did not feel nauseous. There were a few times where I got queasy,
Okay.
but I wouldn't say like nauseous. I was actually really hungry, probably because of the steroids and everything else. But, you know, for the most part, for those 3 months of chemo, except for those few days, I was living my life. I was kind of doing my thing, if you will.
Mhm.
Yeah. And did you have a really good support system throughout this? I know this is so important too, like people to take care of you and, you know, to nurse you and the things that you need so that you can rest, because I want you to elaborate a little bit. You really did live a healthy lifestyle going through this process, which is so important, is probably why you handled everything so beautifully. So can you elaborate on some of those important things that things that you've done or that you're doing that are really helping you through this process?
One, I think the way that I eat, you know,
Yeah.
I think when you know how to fuel your body, it's only going to help you. I truly believe that's why I recovered from my mastectomy so well and so quickly. I truly believe that that's why I thrived while going through chemo, is because, you know, I eat very healthy. I use food as fuel, and that just helped me more than anything else. Number one. Number two, being active. Like, you have to, you know, my oncologist said you want to keep your normal routine as much as you can, even if it's just taking walks. It doesn't have to be a workout, but trying to move. I mean, even in those days where I told you the chemo took me down and I felt terrible and I was on the couch, I still made it out for a walk. It maybe was only 5 or 10 minutes, but I still got myself up and I went outside and I, you know, took in the sunlight and the fresh air and made myself do a walk. And having that support around you as well. Yes. I mean, my friends started a meal train for me. So the weeks of my chemo treatments, having meals, you know, not having to cook, that's one less thing. Having, you know, friends or family help with your carpooling and driving your kids around if you have kids, you know, and activities. I mean, you can't be afraid to ask for things, because
Yeah.
people want to help. They just don't know what to do. So
They
you
don't.
have to tell them, and they are so willing to help you any way that they can.
Yeah, that's so true. And we're so afraid to ask people, but this is not a small thing. I mean, how
Right.
could you have gotten through this without that, you know?
Yeah, you definitely can. You have to have support around you.
So now that you're done with chemo, what's the plan?
So, I still have one more surgery. I'm going to do some reconstruction. So I have that surgery scheduled for next month. They do want to put me on a hormone blocker. So because my cancer was estrogen fueled, and I do have the gene and I do have the ovarian component to kind of deal with at some point. They want to put me on tamoxifen for 5 years, which is a medication that basically, you know, shuts down your estrogen production in your body.
Yeah.
So I am nervous about that. You know, I know that there's some negative side effects that can come along with that. But, you know, I also just, you know,
Take
there are
it one day at a
natural ways
time.
to do things too. And trust me, I am looking into those. You know,
Yeah.
I've been talking to Becky a lot about that,
Oh, yeah.
because, you know, there's some things that I can do naturally to kind of decrease that estrogen as well. And I just want to do everything in my power, because, you know, one thing I have said is that I would not wish what I've gone through on my worst enemy if I had an enemy. And it's
Yeah.
just not something that I want to ever go through again if I don't have
Yeah.
to.
Yeah, we talked about like supporting the liver. So she's flushing out excess estrogen. We talked about like sulforaphane, which is a
Helping our
safe
pathways.
estrogen. It helps with metabolizing estrogen.
Yep.
So those are some of the kind of more natural things we've talked about. But you know, we're definitely not giving that advice on
Yes.
this
Right.
Speak
podcast.
to your
It's just
doctor. It's your own journey, right?
Right. And everybody's journey is different. I mean,
Yep.
it really is. And, you know, Becky just mentioned like the sulforaphane, like I'm eating a lot more kale and cauliflower and broccoli and Brussels sprouts, and
Yeah.
really trying to eat as much of, I always ate that food, but now I'm trying to be even like more
Right.
religious
Awesome.
about eating those things to kind of do some of those things, some, you know, reap some of the benefits that food can give us.
Definitely. And broccoli sprouts is a really good source.
Yes.
But
We used to sprout our own, but my sprouter broke, so I need a new one.
At this point, honey, just give yourself a break and take the Broco blend or take something. Don't be
Right.
focusing on growing them right now.
All right. So, okay, we always like to kind of give people things that they can take away from the episodes we put out. So this is really important. If you could list like 3 really important things that people should pay attention to if they feel like this applies to them or someone that they love, what would those be?
So number 1, and this goes for all women, and look, it goes for men too, because men can get breast cancer, is do your self exams. Do them every single month. If I had been doing my self exams, I would have maybe found my cancer maybe a few months prior. Maybe that would have changed, me having to go through chemo. Maybe it wouldn't have. There's no going back and changing it. But my number 1 thing is to do your self exams. Put a reminder in your calendar, in your phone, that goes off on a certain date every single month and reminds you to do your self exam. If you don't know how, look online. There are tons of tutorials showing you how to do self exams. Number 2, consider getting some genetic testing. If I hadn't had that genetic testing and I wasn't being proactive and screening more often, I had seen my OB in September. He had done a breast exam and nothing was there. So in February, which was 6 months later, I was seeing that oncologist. If I wasn't seeing that doctor, it could have been another 6 months before I went back to my OB, since I wasn't doing my self exams. And maybe that would have been another 6 months before my cancer was found. So, genetic testing is a wonderful tool to be able to be proactive. And just because you have a gene doesn't mean you're going to get that cancer. You don't have to live in fear, but you can at least take some steps to decrease your risk. And the third is the value of a healthy lifestyle. Your health is truly a gift and it cannot be taken for granted. It needs to be a priority no matter what. And I hope nothing like this ever happens to anyone listening, but God forbid it does. If you are living a healthy lifestyle, you are already ahead of the game, if you will. I feel like when you go into something healthy and strong, it just helps you get through it better.
Absolutely.
Yeah,
Absolutely.
And we're not saying like it's the cure, right? It's a supportive mechanism. So, just another reason to move your body, eat well, take care of stress, all the things we talk about on this show, because it can really help when something like this kind of comes up.
Yes, absolutely.
Yeah.
So where else can people find you? I mean, I know you have a great Instagram. You share all kinds of fun stuff on there.
Yeah, so I'm on Instagram, just at Deidre Ferenc, my first and last name, which no one can probably spell, but I'm sure no one knows.
We'll put it in the show notes too.
Yeah, but I'm at Deidre Ferenc. I also have a website. It's dlfwellness.com. So DLF are my initials and then wellness.com. And I have a lot of recipes and some healthy living blog posts on there and stuff like that.
Yeah, I'm sure after listening to this, people are going to want to know, okay, well, what was she doing? Like specifically.
And you're sharing a lot of your journey too on there too, right? So
I am, this is my first breast cancer awareness month as a survivor. And I'm not going to lie, I shed a lot of tears the past few days. It kind of hit me differently. I didn't expect it to hit like that, and it hit me hard kind of the last few days, but I'm like, you know what, if I can take a negative and turn it into a positive for someone else, then that's what I want to do. So that's kind of been, what I've tried to do over these last several months, and just be very transparent that I have good days. I have great days. I have a lot of good and great days, but I have days where, they're not so great too. And that's okay. That's part of this journey.
Right. Yeah. That's a really important thing to say. We don't want people to think you're just like, this was a breeze. She's definitely not saying that at all. But I think you're very positive too in your mindset. And I think that's really helpful.
The only thing you have any control over when you get diagnosed with cancer is your mind and your attitude, your mindset and your attitude. You can't control anything else that's happening. Trust me, I'm a control freak, and that was one of the hardest things for me to deal with. But I tried to control my mindset and my attitude as much as I could. As much as I could, I tried to keep that positive and upbeat because I knew it was only going to help me get through it.
Yeah, it's so true. Well, thank you so much for coming on and, sharing so many details. I think we hear stories of this and we don't know really any of these details. And if I was diagnosed or, thought maybe this was what was going on with me, I would want to know all these things, So I think that people will really get a lot from this. So thanks for sharing.
Yes, well, thanks for having me. It's been great to be here spending time with you ladies.
I know. Well, thank you guys for listening. Thank you guys so much for listening to this episode. And if you love this episode, please leave a review. It only takes a couple minutes. And you can find out more about us on DrBeckyCampbell.com. And you can follow us over at Instagram on @HealthBabesPodcast, @Dr. Becky Campbell, and @Dr. Krystal Hohn. Have an amazing day.